Cuba has been successful in containing Zika. I spoke to Dr. William Schaffner, one of the world's leading experts on infectious diseases. We started out our conversation with the recent Zika cases that have spread to Singapore and Southeast Asia.
I think we're all concerned, Asieh, about how much Zika is spreading now in Southeast Asia. Yeah, it's a problem. I'm also not as aware about the interventions that are going on, and I certainly hope a lot of mosquito-related interventions are happening there, because that's really key.
And talk to us about some of those intervention methods.
You know, it's very difficult because the Aedes mosquito is so tenacious. You have to go around houses and get rid of all standing water. You can't just drive down a street and do spraying with insecticide because that doesn't really get it. So you have to pay attention to standing water. And you know, in Miami-Dade County, they did a lot of that, and even so that wasn't enough. They had to do aerial spraying with insecticides.
Talk to us about Cuba. It seems like Cuba has been rather successful in fighting Zika. What are the lessons other parts of the world can learn from Cuba?
Well, I just wonder whether Cuba has been semi-isolated, so there haven't been any people to carry the Zika virus to Cuba, or much fewer of them. But in any event, because there's now going to be a Congress, an assemblage of people getting together in Cuba, the public health ministers and others from the region, I think that that bodes well not only for Cuba, but for everyone talking with each other to work on regional approaches.
Dr. Schaffner, there's continuing research on virus and how it works. How close are we realistically to having a Zika vaccine? Are we talking in terms of months? Are we talking in terms of years?
Well, let's all cross our fingers. But I was at the CDC, the Centers for Disease Control and Prevention, yesterday where we talked about that. There are several Zika vaccine candidates. 2 of them are starting in clinical trials this year, and there are others in the laboratory that are getting close. So at best, I think we're a year away, but there are many, many units that are working on that very hard now.
And whenever you're developing a vaccine, is another concern making sure the side effects are not horrible side effects?
Well, that's why we have to do everything so rigorously. You must make sure that vaccines are safe and effective. And then you have to aim them at certain populations and test them in those populations to make sure that they do indeed prevent Zika infection. And of course, we have to be very careful that whatever vaccine we use, if we give it to a woman who's pregnant, for example, that it's safe.
Dr. William Schaffner, thank you so much for your time, sir.
Thank you.